months. Once the wound status is healed, we have removed the X-fix and we have done ORF with Ellis plate and recon plate for left distal tibia, sir. Both Ellis and recon, sir. Yes, sir. Anteriorly we have done Ellis. By MIPO technique we have done rush was, yes, sir. Before only it was there. No, sir, investment injury, sir.
24-year-old male with 18 months old follow-up case of grade 3B compound distal third sharp fracture of tibia with segmental fracture of fibula of left leg with implant institute. We have done
Came for implant.
he came for implant removal, sir. 2 years. 24. Ideal.
Nail. 1.5, I think so.
So this is the case done in Unit 2, sir. So 35 years male, grade 2 compound both bone shaft fracture of right leg, sir. The clinical pic, the fracture. We have done open reduction internal fixation with the interlocking nails for tibia.
Kutta.
60 years old male, sir, with dupuytren's contracture of right little and ring finger. Known case of diabetes. He first noticed the deformity 1 year ago, sir. Initially, nodule is seen in the distal palmar crease, followed by presence of cord. These cord further contact and result in flexion deformity of MCP and PIP joints. This is the normal anatomy, where palmar aponeurosis, it continues into distal phalanx. This is normal bands are known, normal fibrous tissue are known as bands, and diseased fibrous tissue are known as cord. What this cord does is like they cause the distal neurovascular bundle sheet to come into center and causes flexion deformities at metacarpophalangeal and PIP joints. This is Houston's tabletop test. When we place our palm flat on the table, all fingers should touch the table. This is known as positive Houston tabletop test. Similar findings such as nodules are also seen in the plantar fascia. If they are seen in palm, they are known as dupuytren's contracture. If they are seen in sole, this is known as Lederhorst disease. We have done multiple Z-plasty in order to lengthen the skin, and as well as partial fasciectomy. That is, we have removed only diseased part of palmar aponeurosis. And we have kept the MCP and PIP inflection by means of a molar slab. This is the immediate post-op status, sir. అడుగుతాడు. జర్నల్ లాస్ట్లో జర్నల్ అన్నాను. Is a 12 years old male with spastic diplegic cerebral palsy with crouch gait and hamstring and adductor spasticities. Comes under GMFCS level 4. On examination, higher mental status and cranial nerves are intact. Popliteal angle on both sides are about 70 degrees. We have done single even multi-level surgery. That is, we have done bilateral percutaneous adductor tenotomy and hamstrings lengthening. We have done an S-shaped incision, following which we see is the saphenous vein. And medially, we have done Z-shaped lengthening of semitendinosus and gracilis tendon. And laterally, we have done biceps femoris fraction lengthenings. This patient also had ankle clonus. So we have done Eggers release by identifying the tibial nerve supply for gastrocnemius and soleus. And we have done neurectomy. Then we have applied an abduction cast. Petrie cast. PETRIE.
Nine-year female with 1-year-old post-op follow-up case of cervicotrochanteric fracture of the left femur with implant in situ. Implant removal was done as the child complains of pain in the lateral aspect of the thigh. She complains of pain in the inserting point 9 years. At 1 year. 8 years. 1 year back. At the age of 8. We have to check whether the vascularity of the head is intact or not. If it is intact, then we can remove it. "18 months male with a 2-year, 5 months old post-op closed proximal third, middle third junction shaft fracture of the right femur with implant in situ." And he came for implant removal, sir. Yes, sir. 67-year female with closed middle third, distal third junction shaft fracture of the left femur. According to Winquist and Hansen, it is type 1. Closed reduction internal fixation was done with interlocking nail. 68-year female with 1 week old intracapsular fracture of the left femur. This is basic cervical, for which hemiarthroplasty was done with bipolar cemented hemi processes, bipolar processes. She is 68, sir.
Six years male with 6 months old post-op middle third shaft fracture of left femur, sir, with implant in situ. We done implant removal, sir. 52 years male with 20 days old tendon Achilles rupture of.
The implant will get buried inside the bone.
End-to-end repair with a crack suturing was done, sir. Mid substance. No, sir.
6 centimeters from insertion.
Close it, sir. After debridement, sir.
After debridement.
Not able, sir.
We have
It was done, sir.
dynamic ultrasound.
Proximal 2.1, sir.
Post-ops.
Yes, sir.
Sir?
Fraction lengthening was done, sir. Fraction lengthening was done, sir. It was 10, sir. So TA. Yes, sir. Yes, sir. We have released proximally, sir. And then the cap decreased, and then fraction lengthening was done, sir. No, sir. Sir, '41 years female with 10 years post-op polycranial fracture of right ulna, sir, with implant instead. We had an implant.
Good morning, everyone. Today's topic is treatment of large femoral and tibial bone defects with plate-assisted bone segment transport. This was taken from Journal of Orthopedic Trauma, published in 2024 May, and was conducted at the Department of Trauma and Orthopedic Surgery, Germany. The authors include Holger and Thorsten et al. Bone defects of the lower extremities are among the most challenging pathologies to treat in orthopedic surgery. There is a plethora of underlying causes of bone defects, including primary bone loss following trauma and secondary bone loss following debridement after trauma or infection, non-union or oncological resection. The aim of bone defect treatment was to achieve consolidation and preserve or restore alignment to allow for weight bearing in a timely manner. Yes, sir. It was studied from 2018 to 22. The treatment options include autologous spongiosa and induced membrane procedure. This is masculate technique, and vascularized autograft of the fibula. The use of bone graft substitutes and bone transport and osteodistraction in case of Elizarov. Spongiosa is callus bone, sir. Autologous means callus bone taken from the own individual. So bone grafting like this. Spongiosa and cancellous. Cancellous bone grafting, autologous spongiosa antam. Supportive, sir, not just cancellous. Irrigation aspiration. No, sir. Maybe they have taken support of fibular stud graft, and along with that they have individual repair, but they haven't explained much about this individual procedures. They have just mentioned the options for. Recently, Barinaga et al. And Olesen introduced the plate-assisted bone segment transport. This technique involves osteodistraction using an intramedullary magnetic nail and internal plate to span the defect during the distraction, which enables the deformity correction and preservation of length during the transport and quicker weight bearing. Promising results have been demonstrated for PABHT with good bony healing. The purpose of this study were to assess clinical and radiographic outcomes as well as complications following PABHT in large bone defects of the lower extremities. The hypothesis was that BHT would show the high bony healing rates, satisfactory patient-related outcomes, and acceptable rates of complications and revisions. Sir. If there is a gap of more than 3 centimeters. The margin is 3 centimeters in this study, sir. If this gap is more than 3 centimeters, they have taken it into consideration. Large 3 centimeters margin betkunar. Yes, sir. A magnetic nail pass. Yes, along with that, they have taken the support of a plate. Plate is just to maintain the distance between the two bony fragments, and in which the intramedullary nail is passed, and they keep on increasing the length of the magnetic nail, which will cause. Sir. Not just spongiosum, sir. With the distraction process itself, they are forming the new bone, sir. Materials and methods. It is a retrospective study, and the patients who underwent PABHT and were at least 1 year postoperatively were included. And indication is bone defect of more than 3 centimeters of tibia or femur is taken into consideration, and the period is between the 2018 to 2022. Sample size is of 15 patients, and the mean age is 51. And total of 8 people, 8 cases of tibial non-union, and 7 femoral cases were taken for the study, and minimum of 1 year of follow-up is taken. Both septic and aseptic. They have taken both septic and aseptic. No, sir. The surgical technique, it is performed in 2 stages. Stage 1 is debridement and antibiotic spacer placement. Following this first step, intravenous antibiotics were administered. They have induced vancomycin and gentamicin as an antibiotic course, and administered until the negative microbiology results from intraoperative samples were available. And stage 2, which is 1.5 months later, a spacer was removed and redebridement was done, and implantation of a precise magnetic intramedullary nail and plate was fixed. Precise is a brand, and magnetic intramedullary nail is for the intramedullary nail. At the tip of the nail, there is a magnetic part through which, through the motorized thing, we can increase the length of the tips. Distraction, yes, sir. 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 Plate is fixed only to the two extremities, sir. After that, we have to do corticotomy. In between the segment, we won't fix it with the screws. The two extremes has to be fixed with the bicortical screws, and the remaining in between the. Let me show the video once so that we can get better understanding. We have done corticotomy, and we have passed the intramedullary nail after reaming, sir. Sir? No, not we have done, sir. They have done, sir. Sir, it was done. The two ends of the femoral segment were attached with the bicortical screws, and the part which is below the corticotomy done, part which is below the corticotomy site was used as an enhancement, bone enhancement site, sir. Cephalomedullary. Usually 0.7 to 1 mm per day. Yes, sir. Next video. Mali beta mantara. And the X-rays, it is better, sir. The coming first of X-rays. It is performed in two stages. Stage 1 is debridement and antibiotic spacer placement. Following this first step, intravenous antibiotics are administered until the negative microbiology results from the intraoperative samples are available. And in stage 2, 6 weeks later, the spacer removal was done, and debridement and implantation of precise magnetic intramedullary nail and plate is done. Corticotomy performed with the drill, and osteotomy is used, or else a giggly saw. It is a flexible threaded saucer. It is also used to do the corticotomy. And fixation with the locking plate and interlocking bolts are used, and plate osteosynthesis is performed by bridging the transport fragment. And the large fragment plates are recommended to fix the two extreme ends of the bony segments. Has to be free. It has to be free. Yes. The plate is fixed using at least 3 bicortical locking screws in each fragment in tibia and at least 4 in the femur. Next, to the benefit of construct stability, the plate also allows for 3-dimensional correction of the deformities. Yes, sir. First nail is passed, and then supportingly plate is done, sir. In the same sitting. No, sir. Transport fragment is just the bony fragment from the tibia, which has to be reduced down, sir. Not transporting another segment of the bone. Just like a distraction process. There is one more procedure called recharge procedure. Usually, this nail stroke limit is 8 centimeters. For a newborn formation up to 8 centimeters, this PABHT is used. If the gap is more than 8 centimeters, this recharge procedure has to be done. In this Therefore, the nail must be retracted, which is antegrade transport, or distracted, retrograde transport, if the transporter is more than 8 centimeters if needed. Recharge is required in almost 47% of patients done by a minor surgery, in which the interlocking bolt removal from the transport fragment and nail retraction or distraction has to be done, and relocking of the transport fragment. Sir, we'll images ఇవ్వలేదు సార్ దీనికి. సార్ రీఛార్జ్ ప్రొసీజర్కి ఇవ్వలేదు కానీ మీ రిమైనింగ్ దానికి ఎక్స్రేస్లో బెటర్ అండర్స్టాండింగ్ సార్ మనకి నెక్స్ట్లో. If the gap is more than 8 centimeters, if we want to form the new bone, if we take an example of 14 centimeters gap, up to 8 centimeters, the regular conventional method is useful. For the remaining rest of the 6 centimeters, we have to do recharge. Redo means we have to extrally do to the conventional method. Sir, ఇందులో ఇవ్వలేదు సార్ ఈ ఇది ఆర్టికల్ మెన్షన్. And docking site procedure. Docking site, which comprises the two bony ends of the former defect, is sometimes problematic since consolidation can be prolonged. In this procedure, debridement plus autologous bone graft from the iliac crest, reaming, irrigation and aspiration. In some cases, the transport fragment is fixed to the main fragment using an additional plate. If the docking of the two ends is not attached and not fixed with proper union, then we have to use an autograft from iliac crest, or else we can use an bony plate fixation to promote the union rate. Post-operative rehabilitation. Start distraction on day 7 post-operatively. For tibia it is 0.75 mm per day, and for femur it is 0.9 mm per day. And weekly x-rays, bi-weekly follow-up has to be done, and partial weight bearing initiated after the docking. And active and passive range of movement exercises of all adjacent joints are started immediately following surgery when soft tissue swelling is subsided. And follow-up is bi-weekly during distraction and 6 weekly after docking. Functional outcome measured after 1 year. Radiographic evaluation is a pre-op radiographic apparent bone gap is measured. Bone considered consolidated if the 3 out of 4 cortices are healed. And post-operative radiographs were assessed for RABG and consolidation of both the regenerate and docking site. Time to regenerate and docking site consolidation recorded, and if consolidation was difficult to assess, computer CT was performed. So these were the radiographic images during the PABHT procedure of the tibia. The case is a 20-year-old man with non-union following multiple revisions after a pathological fracture of the lower leg associated with a juvenile bone cyst 6 years ago. In the image B, PABHT procedure of the resection non-union was done. Here in image A, the distal end of the tibia, you can see the non-union, and for which the resection was done. And proximally, at the proximal 1/3, the corticotomy was done, and then the lengthening, the gap is maintained, for which the newborn formation takes place at the corticotomy site, sir. Regeneration, no, sir. Elizara way, sir. Yes, sir. Anterior medial units. Yes, sir. Stability provides, and also prevents the rotational. Mm. These are the 1 year post-op follow-up cases, which demonstrates the complete consolidation at these sites, sir. Yes, sir. And also there is appears to be proper, sir. The plate itself helps in providing the rotation stability, sir, and also not just the length, but also to provide the rotational stability, sir. And also the proper docking was visible at the distal end, sir. Not just tumors. Infected, sir, septic and aseptic, both conditions it is mentioned. Yes, sir. This case is of this is a pathological with tumor, sir. And there is one more case to show, sir. Mm. Laterally, sir. Anterior medial, posterior. There is one more case in this 53-year-old man following debridement and placement of an antibiotic spacer for septic non-union. The patient had multiple operative revisions after having sustained a closed comminuted femoral fracture. Sir. Okay, sir. Sir. Okay, sir. Okay, sir. Mm. We have done a similar case last week, sir, but not with the plate-assisted bone segment transport. But we have taken a fibular, avascularized fibular stud graft. I'm just showing an alternative method to this. No. It costs around 8 lakhs in India. Yes, sir. 8 lakhs per person, sir. 8 to 15 lakhs in India. Mm. These were the immediate post-operative images. This is that septic case, like open injury, infected. Yes, sir. They have done multiple revisions for this case, and later these were the immediate post-operative images. And segment and transport was done in this type C, sir. And in the image D, we can, after a period of 20 months, there is complete osteosynthesis, and proper docking was visible, and the complete attainment of bone was vascularized bone was visible, sir, without any gap visible. There is initially only two procedures, sir. If the gap is more than 8 centimeters, they are considering the extra recharge procedure and docking. First is debridement with antibiotic installation, and remaining nailing and plating. In the second, debridement, and along with that plating was done in second. It is 6 weeks post-operative image, sir. It's still, sir. Mm. No, sir. They haven't mentioned about extra support, no, teriparatide. Sir. Mm. 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 No, sir. Yes. Then- No, sir. Nanjulas. Sir. Mm. Mm. But it's deep inside. Mm. హోల్డ్ చేసుకొని మళ్ళీ మ్యాలెట్తో పైకి కొడుతుంది సార్. సార్ results. The complications include is yet to- the complications include iliac crest fracture during the bone harvest and broken screws. Yes, sir. No, I haven't seen any fracture. Sir. Broken screws and malalignment in 2 patients, and also 2 distal femoral replacements in patients with poor consolidation. If we iliac crest is maybe osteotomy, straight osteotomy పెడతాం కదా సార్. if it goes too deep, it might split the bony fragment. Verticalగా ఏమన్నా vertical split అయి ఉండొచ్చు, vertical fracture. The strengths of the study is it avoids a long-term external fixation and high rate of callus consolidation, and enables deformity correction, and all the patients achieved a full weight bearing. And the limitations include it's a small heterogeneous cohort study, and short follow for some outcomes average is 29 months, and only 60% docking site union, and needs further refinements. It's a comparison with Elizaro, comparable or better consolidation than Elizaro technique, and less patient morbidity, no pin site infections or long-term external fixatory issues. And first study to report the consolidated callus in 93% of patients with up to 125 mm defects. With CT, imaging maybe. They haven't mentioned, sir, but they said like CT has been used for better understanding of consolidation and docking. Sir, no, 3 centimeters కన్నా ఎక్కువ ఉన్న కేసెస్కి వీళ్ళు తీసుకున్నారు సార్. మార్జిన్ ఇస్ 3 centimeters. It can go up to 12.5 centimeters వరకు ఉంది కదా సార్. Needs further evaluation in the larger and more homogeneous populations. It is still a developing research. PABHT demonstrated high consolidation rates of the transport callus with few complications. Although full weight bearing was achieved in all patients, complete consolidation of the docking site was only present in 60% of the cases. If there is complete consolidation and docking was visible on radiographic images. No, sir. 3 months. No, sir. It's more than 1.5 years. Only physiotherapy was done, sir. Sir. Radiographic visible docking untene they'll started weight bearing, sir. No, sir. I said like complete. Sir. Similar to that of LRS, I guess. Limb construction. So I got a similar case 1 week back. 21-year male, 3 months old, 3 months old post-operative status of grade 3B compound middle third shaft fracture of the right tibia with external fixator. Sir. Yes, sir. This was the image X-ray taken at the time of injury, sir. Appears to be comminuted, and there is. No, sir. This was the image taken at the emergency, for which actional fixation was done to stabilize the fracture until the soft tissue healing was visually appeared. After a period of 3 months after proper soft tissue healing, we removed the X-fix, and then after removing the X-fix, this was the image, and still the comminution is present with the visible gaping seen, and we have done avascularized fibula stud was placed along with the graft taken from the iliac crest. Sir. Because the surrounding soft tissue, the vascularity is intact, so we. It can be done, sir. Yes, sir. 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 We have to take extra length of fibula, sir, like 3 centimeters proximally and. Sir.
Debiliation of the fibula, Huntington procedure.
Hmm. Sir. Triple R. Sir. Hmm. Sir. Hmm. Yes, sir. Graft is taken from the iliac crest and is supplemented at the site. Corticocancellous, yes. Still, sir. Time will. Hopefully. We can, sir. It is not cost effective, so. Yes, sir. Eh, After 3 months, actually, sir. After 3 months. Physiotherapy, only physiotherapy was advised, sir. No. Thanks. Not weight bearing, sir. Non-weight bearing. Non-weight bearing. Active knee range of movements. Actually, non-weight bearing, sir. With the stand, he is walking, but non-weight bearing, sir. Mm. Sir. Ante, sir. I pins are finished. I pins are unable. In this case, sir, it is around 4 centimeters. Yes, sir. Opposite. No, it is kept, sir. Actually, the loose fragments hasn't come out of the healthy, sir. Yes, sir. We haven't removed any bony fragments from the site. Yes, sir. Yes, sir. Nothing, sir. Finished. Nothing, sir. Sir. First thing, they should have taken a more sample size, and they should have followed a period of more than 2 to 3 years. It is just a post-op follow-up of just 1 year. The study has conducted between 2018 to 22. They could have studied up to 24. So, sir, comparative study. Mm, sir, X-rays అయిపోయినాయి. ఫస్ట్లో ఎక్స్రేస్ అయిపోయినాయి, లాస్ట్లో జర్నల్ అయిపోయింది సార్, అందరికీ అయిపోయింది.
Saturday. This Saturday there is a live surgery demonstration from Apollo, but we will be transmitting there. So details will come to you. Posted. VD. Moderation. Moderation. Four. 2 to 4. Okay.
This is all. Until done procedure.